Good morning, everyone. Welcome to the August 23rd, 2022 in-services. And today we're going to have Taylor, and she's going to be talking on STDs in the elderly. Please feel free to either ask questions in the chat box as you have them, and Taylor will answer them as they come up, or she'll wait to the end to answer them, or just wait till the very end. But Taylor, I'm turning it over all to you.
Okay, good morning, everybody. Like Dr. Baldwin said, my name is Taylor Prelo. I'm a fourth-year pharmacy student at Campbell, and today I wanted to have a conversation about the importance of sexual health, but in older and elderly populations, since I feel like that's not something that's talked about very often. It's not very comfortable, but we're going to try and make that a little more comfortable today. So let me share my screen. Let's see. Okay, there we go. Okay, so yes, my topic is destigmatizing sexual health in the elderly. Let's talk about it. So by the end of this presentation, I want us to be able to explore the prevalence of sexually transmitted infections, also known as STIs, in elderly and older populations. So that includes people, I'll focus in on people who are about 55 and older, but certain statistics will touch on groups 45 and older. I also want to identify the most common infections within this age group specifically and their treatment options. And then just kind of like debunk some associated myths, things we either just kind of assume without realizing or things we're just too uncomfortable to talk about. So the prevalence of STI, also known as sexually transmitted infection, some of you may have grown up hearing STD, sexually transmitted disease, but I feel like STI is a more comfortable term. Disease has a very negative connotation. Infection to me has the connotation of it can be cleared up, which most of them can. But anyway, men and women 55 years and older accounted for, make up 9 and 17% of all new HIV diagnoses, respectively. And half of all current HIV diagnoses are in someone 50 or older. This is actually alarming because I want to say in about 2005, the rates of HIV amongst this age group only made up about 24% of HIV cases. So 15, 17 years later, and we're already up double to 50% of all HIV diagnoses. That's a lot. Older adults, those 45 and older, like I said, do exhibit the fastest growing rate of STI infection. That doesn't mean most STI infections happen in that age group, but the rate of increase, we're seeing it happen in this age group, is blowing the other age groups out of the water. So I feel like this is a conversation that really needs to be had. Men over 55 this year alone in the state of North Carolina accounted for 363 new cases of gonorrhea or chlamydial infection, while women accounted for about 109.
Recording in progress.
Men account for 193 cases of gonorrhea, while women were 27 of those cases. And this is just this year alone in North Carolina. And for chlamydia, men were 170 of the new cases, while women were 82. And this is all in the age group 55 and older. So which are the most common STIs? Well, among older adults, and I'm focusing in on those 55 and older, you can argue 45 and older, but most of the statistics I looked at were in those 55 and older. The 3 most common STIs are chlamydia, gonorrhea, and HIV. So what are some long-term untreated or risks of untreated STIs? Infection of the joints. Gonorrhea specifically when untreated can spread to the joints, causing inflammation, pain, and subsequent infection. Increased risk of HIV. Having gonorrhea or chlamydia, gonorrhea especially, can increase your risk of contracting HIV because it makes you more susceptible. Pelvic inflammatory disease. This is a disease of the lower abdominal region. It can affect, I want to say like the kidneys, it can affect the liver, it can affect some of those organs down in the lower GI tract, and especially kind of in the genitourinary tract. I can't remember exactly which organs, but I know It's lower, like that area below your belly button and right around the genital urinary area. That's where you're going to see symptoms of this disease. Testicular infection, and specifically infection also near, but not necessarily on the testicles. Prostate gland infection, that is rare, but it can happen if you let an STI go on too long. And certain STIs can increase your risk of contracting certain cancers. So it's really important that we want to make sure we're having these conversations with the older population, because we still want to maintain a quality of life. You know, everyone doesn't want to just live, people want a quality of life. And it's hard to do that when you're treating something that could have been solved earlier on if we caught it a couple of years earlier. So signs and symptoms of the 3 different diseases. With chlamydia, you can see discharge in men and women. You can experience pain while urinating or having intercourse. You can also see rectal symptoms, pain, bleeding, hemorrhoids, pelvic pain in general, again, testicular pain, and even eye infections. Let's say if while engaging in intercourse, you know, your hands get dirty with bodily fluids or whatever. Sometimes we touch our face. I think we all learned from COVID, we touch our face a lot more than we realize. And that can result in transferring those bodily fluids to the eyes and causing eye infections. With gonorrhea, again, we can see increased discharge. And for women, it could be a change in how you discharge. Women do naturally discharge. It is a means of of the vagina trying to clean itself out. But when you see changes, you know, difference in color, odor, and you know you've recently been sexually active, that's something to check on. Pelvic and abdominal pain, pain with urination, vaginal bleeding, excuse me. There we go. Rectal discharge, and like I said, joint infections. If gonorrhea goes untreated, it can spread to the joints. And then finally, HIV. There are different stages of the HIV disease. There's early stage right after infection. There's a latent period where you show no symptoms. There's a much later period where you show a lot of symptoms. And then there's full-blown AIDS. I just listed some of the more common symptoms that you can see in any of those stages outside of the latent stage. In early stages, you can see a fever, you know, that just kind of comes out of nowhere and lasts for weeks. And in later stages, it's a fever that's recurrent. It seems like you always have a fever, you always have these flu-like symptoms, but you're consistently testing negative for the flu, you know, but you haven't been around anyone that's had it. Lymph node swelling. This is one of the hallmark symptoms of HIV. You can see it in early and late stage HIV when you're symptomatic. It gets a lot worse in that later symptomatic stage. Weight loss is, again, something you can see early on or much later in the disease. It is usually a lot more prevalent in that later symptomatic stage. You can also kind of see a red raised rash. That's more associated with early stages of HIV. And on more fair skin tones, it's going to appear red and widespread over the limbs or trunk, the head, the tops of the hands and feet. And in darker skin tones, it's going to appear more raised and purple. You can see oral thrush in early HIV, but in later stage HIV, you can actually see lesions or spots on the tongue or inside the mouth. You can also have persistent fatigue. That is something we see throughout cases in late stage HIV, and you can see diarrhea in both early and late stage HIV. That's a lot so far. I hope you guys are keeping up. First, I want to talk about treatment in chlamydia. There's a drug called doxycycline. It is one of the tetracycline drugs. This is going to be a twice daily drug for 7 days that is going to clear out the chlamydia and cure you of it. It's 100 milligrams. It can cause, you know, some inflammation in the esophagus, that's esophagitis, and even some skin reactions, things like it can cause hyperpigmentation. So that's darkening of the skin. And it just makes you a lot more sensitive to light. So something we encourage people to do is to use your sunscreen. Y'all should be using it anyway, but definitely on doxycycline, especially if you end up having to take it for more than 7 days. Drink it with a full 8-ounce glass of water, and don't take it before going to sleep or laying down. That can help keep you from developing that esophagitis. And then the alternative options are levofloxacin and azithromycin. They're not terrible, but they're not the best. Doxycycline is preferred, but these are for if you can't tolerate doxycycline or tetracyclines. Excuse me, my bad. And so that would be levofloxacin, 500 milligrams once a day for 7 days, or azithromycin, also known as Z-Max, 1 gram in a single oral dose. Azithromycin notably can cause diarrhea, and also something called ototoxicity. That's where it can cause kind of ear issues. And since the ear is responsible for balance, if you don't address those, it can lead to balance disorders. But that only happens if you're taking it over a longer period of time. But the main thing we look for with the azithromycin is the diarrhea associated with the large dose. So that's why I'm not the biggest fan of that alternative. And with levofloxacin, it can cause some itching, rash, constipation. And in those with history of like tendon injuries, it can cause tendon rupture. But you can get around contracting those adverse effects by making sure you take it with a full glass of water and remain hydrated while on this regimen. And with all of these, I would encourage you to remain hydrated. With gonorrhea, the best option we like is ceftriaxone, but that is an injection. That's a downside of that. The 500 milligram injection is most suitable for those who are over, for those who are under 330 pounds. I apologize. And the 1 gram intramuscular injection is best for those equal to or over 330 pounds. Alternatively, you can also try gentamicin, 240 milligram IM injection, plus an oral dose of azithromycin, but this time it's 2 grams. You only take that one time. Or you could do cefazime, 800 milligrams orally 1 time. So ceftriaxone can cause skin reactions or diarrhea, while gentamicin can cause black stool. So if while taking gentamicin, you're kind of seeing these black tarry stools, it's nothing to be alarmed about. But it is something I would reach out to your doctor about. Doesn't necessarily mean anything is wrong. It's just something to keep an eye on. You could also see changes in urination. You might be going more frequently, or general abdominal discomfort. Again, while on these medications, you want to be drinking plenty of water, plenty of fluids. And if chlamydia has not been ruled out, but you are positive for gonorrhea, it is best practice to go ahead and treat. We'll first test for chlamydia, but if there's not an availability to test for chlamydia, it's best to go ahead and treat, because like I said earlier, already having an STI can increase your risk of contracting other STIs, especially HIV. So HIV treatment is a lot more complex to talk about. I'm not really going to get into detail about the different treatment options. There are 4 different classes of drugs that are used to formulate HIV drugs, and most HIV drugs are composed of at least 2 to 3 drugs from these 4 classes. So it would take us a while to get through HIV. So I'm just kind of going to gloss over antiretroviral therapy, or ART, and then 2 things called PrEP and PEP. So ART, like I said, is a large class of drugs used to treat HIV. It is a decision that is best made between you and your doctor, because some options are better based on your genetics, based on your viral load, based on if we can determine if you're early or late stage HIV. There's a lot of different factors that play into choosing ART therapy. And then I also want to talk about PrEP and PEP. I don't know if anyone here has heard of either of these, but I love these because these allow not only people with HIV, but partners of people with HIV to still lead normal lives without being worried about exposure, or even if exposure does happen, there's a likelihood we can keep you from contracting HIV. So PrEP is basically used to prevent contracting HIV. This is what you would use if you were going to choose to engage with someone who is a known infected partner. There are two PrEP drugs. There's Descovy and Truvada. They're both consistent of drugs called, I believe, emtricitabine, tenofovir, and then I think Descovy is the one that has the third drug group in it. But Truvada is the one that has clinical data showing that it is up to 99% effective at preventing infection when taken daily. But in the study, it really was not observed how well it works in people who don't take it daily. So this is best for people who are going to be continually and regularly engaging with a partner who they know is positive. PEP, I forgot to mention, PrEP stands for pre-exposure prophylaxis, and PEP is post-exposure prophylaxis. PEP is used after exposure. It's most effective in the first 72 hours after exposure. So that's why it's important, even if you are 55, 65, 75, 85, ask your partner, what is your status? If they've been tested earlier this year or they haven't been tested for 30 years, they need to know. Everybody needs to know their status. So this is why it's important to ask your partner, what is your status? And even if you forget to, in the heat of the moment, you can still have that conversation after the fact. That is still a valid conversation to have after the fact. And if you find out you have been exposed, we do have post-exposure prophylactic drugs. They're taken once or twice a day for 28 days. And then we retest to see if you come up positive or negative. So here's some common misconceptions associated with why we don't have these conversations in older people and why we're seeing these increasing rates of STI in this age group. Some people just believe older people don't have sex. That's not the truth. It's not. A lot of people assume that everyone just already knows all the associated risks, but conversations about sexual health weren't really normalized until about 40 years ago in the 80s. Early STI signs are often confused for normal signs of aging. So a lot of those symptoms I listed earlier, the fatigue, that's tiredness, the persistent fever, the muscle aches and pains. If you're talking to someone who's 65, what is your first thought going to be? A lot of people think just because they can't get pregnant, they don't need a condom. And then also, chronic disease does not affect STI risk. That's not necessarily true. So let's debunk some of these. Older people are, in fact, sexually active and should take the same precautions as younger people. There's actually a documented increase in Viagra use in the early 90s, and then subsequent increase in STI infection in older groups of people. Because Viagra, I believe it was FDA approved in 1998, and it's around 2000 is when we start to see STI rates increased. I think it was like to 17% in the year 2000. So that's after 2 years of being FDA approved for, not sexual performance enhancement, but erectile dysfunction. And it's something we still see continue to increase to this day. So the same rules apply for older people. Go get checked in between partners with any new partners. And I would say every 6 months to a year with what I call long-term dynamic partners. That I understand in this age group, there are people who've been together 15, 20 years. There are people who've been together 3, 4 years, a year. It doesn't matter, especially if there are kind of periods of off and on. It's good to go get checked. That's not something a lot of people like to talk about. when we talk about long-term partner situations, but it's better to know and have that information and be empowered in that information as opposed to just not knowing. And again, condoms. Condoms are important. Just because you do not have the ability to get pregnant anymore does not mean you should not be using a condom. You can still contract one of these STIs, something that can be completely avoided. So condom usage should still be observed regardless of your ability to get pregnant or impregnate. And then also, like I talked about, those kind of early signs of infection, being confused for signs of aging. So if you have someone, we have those adults in our life who are a little more outspoken than others, if you know there's an older adult in your life that you care about who is still living a somewhat vibrant personal life, and they're starting to show these kind of unexplained flu-like symptoms, like it wouldn't hurt to see if you can open up this conversation. I understand a lot of people did not grow up having conversations about sexual health. Sexual health was not something that was really talked about until the 80s, and that was only because of the HIV/AIDS epidemic and the way it boomed. So there's an entire group of like baby boomers who they missed that conversation, They may or may not be comfortable with having this conversation, but you want to do your best to meet people where they're at. Because again, it's better to be empowered and knowing than to just not know. Excuse me. So like I said, those conversations, we've only really been having conversations like this for about 40 years, maybe 60 if you want to take it back to the sexual revolution, but even then, not so much. Chronic disease states, when they are allowed to remain uncontrolled for long periods of time, I don't think they necessarily, if I have this correct, increase your rate of contracting STIs, but when you've got diabetes, hypertension, all these different disease states that are out of control and they've been out of control for a while, that can start to wear down at the body and in turn your immune system. So in a way, not controlling these disease states can kind of help to increase your risk of contracting STI because your body's already working so hard, in other facets of trying to maintain your health. And like I said earlier, you want to remember to just meet people where they're at, above all else, meet people where they're at. You can't force someone to have this conversation, but you can work with an open door, and I feel like people who are sexually active, regardless of age, I would hope, there would be a door open to start to engage in these conversations. You don't have to hit them with as much information as I've introduced to you all today, but sex is a normal part of life and human development. And everyone should be given the tools to manage their own sexual and whole body health. So finally, I want to talk about testing resources specific to North Carolina. Wake County Health does have a clinic that offers free and discreet testing services to all every Tuesday and Thursday. I understand cost is something that a lot of people worry about, but this is completely free. They are located in Raleigh on 10 Sunnybrook Road, and they can be contacted at this number. So if you or someone you know, it's been a while and you'd like to know, or you feel like there's something you need to go check on, here's a resource you can utilize. And these are my references. That was a lot, but thank you all for listening. Does anyone have any questions? Let me go into the chat box, actually.
Excellent. Excellent in service. So who might have some questions for her?
I had a thought.
Hang on. Is that Judy?
Yes.
Okay.
Just based on the fact that I remember several years ago hearing that younger people were not being as cautious. And so I'm wondering if if the increase that we're seeing today is related to the fact that the people who weren't in their 20s, young adults back in the 80s when AIDS first and HIV first, came about
Mhm.
and was such a crisis, that if the people who became more lax with it, in the years following, if that's attributing to the increase we're seeing now with people over 50.
Do you know the answer to that, Taylor?
I do not. Just to make sure I'm understanding what you're asking correctly, you're asking if the laxness we saw in the 80s with the HIV.
No. Back in the 80s and into the early 90s, people were very, very cautious.
Right.
And because it was so scary for people. But then in the late 90s, early 2000s, they were noticing that people who were in their young adults were not being as cautious when they were being sexually active, because that 15 years before, in the 81, when AIDS first showed up,
Right.
and people were just highly concerned and worried and scared, that precautions were taken by everybody, that had kind of taken a back seat.
Right.
And so I'm wondering if some of the increase that we're seeing and that we may continue to see are going to be people who were possibly infected at a younger age. And not, and so I guess I would want to know the difference between people who are aging into being a senior that are already infected versus new rates of infections.
Okay.
I think we're going to see an increase just from some of those people in the early 2000s who, weren't old enough to understand how deadly or how devastating the HIV diagnosis was in the 80s.
I do think, and Dr. Baldwin, please correct me if I'm wrong, because I did
I
not.
was gonna say, Judy, they actually, go ahead, Taylor, and then I'll pipe in. I have to mute myself because they're having class right outside of my door. So
Dr. Baldwin probably knows the exact statistics of number of people who are being newly infected versus people who were infected. Because that latent period I talked about, that can last for years. Like, there are people, who have had latent periods of like a decade. Like, when I say years, I mean children are being born and starting school and making it to middle school when I say years. So I don't know the exact statistics, but I'm quite sure that a number of the cases that we're seeing of newly infected in these older populations are people who probably had it for years and didn't realize it. But I also know that I wish I knew the exact statistics, because the increase that we've seen with Viagra usage, I think that is leading to increases in new cases. Right, so people who are becoming newly infected. I think that's right. I see Dr. Baldwin nodding. Could you chime in now? Because that's about as
so
far as
I'm actually, Judy, pulling the actual, because the perk of STDs is we actually track it by county, by gender, by age, by race. And the data that Taylor presented is actually new, as in not had it, not lived with it for years, but new diagnosis of it. We have seen, and that's what drove physicians to look at, because all of a sudden they started seeing seniors show up trying to figure out what was going wrong with them, and they were testing them, running the gamut of tests, and realized they had STDs, gonorrhea, chlamydia, HIV. And so those cases that you're wondering about, they've been caught, or they have unfortunately died 20, 30, 40 years ago. Because you're talking about the AIDS epidemic that happened moons ago.
No, I'm not talking about that. I'm talking about a study that was done about 5 or 6 years ago that showed that younger people in the early 2000s
Mhm.
were not taking the same precautions regarding safe sex,
Okay,
and that went back into the late 90s, and they attributed that to the fact that that group of young people were young enough
yep,
were not born yet when the AIDS epidemic began, and they did not have the same urgency to practice safe sex and take
okay.
precautions. And I'm wondering how many of them might be they've got it and they're aging into and being counted as these cases with seniors. And yeah, I realize that a lot of the people from the 80s and the original are dead, but I'm talking about that cluster that they had where all of a sudden they realized they needed
Gotcha.
safe sex message back out to the younger people.
Yep, okay.
So I think that cluster, because if they would have missed the epidemic of the 80s, that would mean when they were infected, they would have been, let's say they were born right at the beginning of the 80s, in the early 2000s, they probably would have been in their, like they would have been my age. I'm 24. So they would have been in their early to mid 20s. And that would make them today in their 40s, maybe.
But
their
also
50s.
if you look at elementary school kids who are like between 5 and 10, they're going to be in that age of over 50. And most kids aren't going to pay attention to something like that unless it's in their family. So, I mean, it was just a thought. It was just a thought that, are we seeing some people who are just aging in out of that group?
We are. The short, quick answer is we are absolutely seeing individuals with some of these STIs that are just aging into this population. For some of the more, I don't want to say benign, but some of them less, not HIV, but some of them, a lot of the new, when we say new, they mean legitimate, more new cases. They've caught it within the past 6 months or so. And that's just due to testing of them, but some of them have aged into us. And we're also seeing seniors that are living with these STIs that caught them in their 20s, 30s, 40s, 50s that are now aging into our aging population and living in our senior living communities and in our nursing homes as well.
I think it also should be noted that I talked about viral loads earlier. One of the ways we can tell between like, okay, you've been infected within the last 6 months versus you were infected years ago is by looking at viral loads. So someone with an undetectable viral load is about 20 to 50 viral copies. We try to get it below 20. That is truly undetectable. But when you see someone who they have not been medicated, they were infected 4 months ago, their viral load is going to be like 200,000. It's going to be like 300,000. So when they're testing these people, they're probably seeing viral loads that aren't quite, in the hundreds of thousands, maybe more like in the tens of thousands, or inching up on the hundreds of thousands. I don't know the exact numbers, but that's one of the indicators that we use to tell like, okay, were you recently infected or have you been walking around like this for a couple of years? Excuse me. So that's one of the ways we can tell between people who, like I said, they probably had it for half a decade versus someone who has been infected at the very least within the last 3 months. I think you don't start to see viral replication large enough that comes up on testing until you're not going to test positive immediately. I think it takes like 2 to 3 months for people to begin to test positive once they've been exposed. But yeah, thank you, Judy, for asking the question. It was something that's important to talk about. It wasn't something I looked into too deeply, but thank you for asking. I saw a couple other people unmute. Did anyone else have a question?
I just wanted to say that was a great presentation. It was really well presented, and really good points that you made is like, it really is kind of off all of our radars. You know, seniors and older adults just have so many other illnesses and ailments and issues that we kind of lose touch with, that this actually could be an issue or a concern. And it just kind of falls off, I think, everyone's radar. And just to add to like some of the points earlier, I think it's interesting that, you know, one of the things is seniors are living healthier and longer. So what was 65, you know, years ago is a lot healthier 65 now for a lot of folks. So with good health is good sexual health or more active sexual behavior. So I could see where the increase would be there. And it would be really interesting to see a study where like social media has played a role in this, because where I think we have more seniors that use social media and dating sites and connection sites, that how it's impacted, because whereas seniors live a little bit more isolated now, they're not. And where our younger generations are a little bit less social face to face and more interactive digitally, that they may actually be going down in numbers, whereas our seniors are connecting more and maybe going up in numbers. So it'd be interesting to see how social media maybe plays a role in that. But it was a great presentation. Thank you.
Thank you so much. And it's actually interesting you brought that up. One of the articles that I read showed that we're seeing a lot more divorces happening kind of in that midlife period, people, you know, starting over again. And like you said, we're seeing increased incidences of senior age groups also being on dating sites, reconnecting sites. So that is one of the factors that plays into why we've seen this. Nice job picking up on that. But thank you. I see Shirley, you have your mic on. Did you want to ask a question? No?
I don't think she has her mic on. If anybody else has questions, feel free to ping in, or you can email me later and I will happily try to answer them or forward them off to Taylor. Otherwise, thank you, Taylor.
Thank you, everybody.